You're muted, Caroline.
Hi, welcome everyone. Welcome to the webinar. I started talking there and I had the classic, I was still on mute, so Doreen, make sure you're off mute. That wasn't a great start, but let's be smooth. Welcome everyone to the NNN Cross Cutting Group webinar. We're really excited today to have you invited for the multi-sectoral coordination webinar. So today we really wanted to bring together a lot of practical examples, because a lot of us are really talking in the NNN about the cross-sectoral collaboration and coordination, and we've got some great examples to share with you today. So first of all, just before we start talking about ourselves and invite our speakers, I'm just going to launch a poll here just to find out where people are joining from today. So it would be great if you could type some responses in the chat, and yeah, we can get to know a bit more about where you are coming from. Great, yeah, classic, United Kingdom, USA. Let's hope we get some diversity in here as well, from all over. And it's nice to see though lots of people still joining, and where people are coming from. So keep it's always nice to know, yeah, where people are coming from and feel more connected with everyone, even though we can't see you all on the screen. So feel free to write your responses. And also in the chat is also great. And then also I was just going to launch another poll, because we'd be really keen to know from the people who are calling in today what topics that we've got the cross-cutting groups on, what topics are you know, connected with your role, what sort of, you know, just so we know, is the NNN cross-cutting groups covering all these areas. So these polls will be open throughout the webinar, so great if you can tick the boxes. Oh, amazing, I can see loads of different countries represented. Oh, and I can see Scotland represented as well, so yay to that, special mention. But we've got yeah, Senegal, Kenya, we can see Italy, Tanzania, amazing. So many places. That's really exciting. And yeah, if you want to introduce yourself in the chat, that's great. Or we also have the Q&A open throughout. So if you've got any questions for any of our speakers, feel free to add. Okay, I'll stop waffling now and I'll pass over to Doreen to give us another quick intro about our cross-cutting groups, and then we're going to get some introduction from the chair of the NNN. So Doreen, over to you.
Thanks, Caroline, and hey everyone. I'm Doreen, the co-chair of the NNN WASH Working Group and also head of operations at NALA. I'm very excited for this webinar. It is hosted by the NNN Cross Cutting Groups, as Caroline mentioned, and was initiated following the collaborative work between the groups that started at the 2023 annual conference. This webinar will showcase how multi-sectoral coordination looks like in action, and when different organizations and partners come together to improve health. We chose this theme because multi-sectoral coordination is the main pillar of the work of all NNN cross-cutting groups, but more on that later. So as Caroline said, we will start the webinar with opening remarks by Dr. Jemish Arharya, the chair of the NNN and the head of programs and learning at Leprosy Mission Nepal.
Good morning, good afternoon, and good evening, everyone. I'm Dr. Jemish Arharya, the current chair of the Entities NGO Network, or the NNN. First of all, a very warm welcome to all of you to the Joint Cross-Cutting Group Coalition webinar. The WHO NTD roadmap for 2030 identifies multi-sectoral coordination as an essential component of reaching roadmap targets and ensuring sustainable NTD programs. The NNN cross-cutting groups demonstrate the importance of working across sectors and with different actors at all levels to reach these objectives. This webinar will highlight how multi-sectoral engagement has been employed in different contexts for more sustainable NTD programs. Before we kick off the webinar, a brief update on the NNN. The Neglected Tropical Diseases NGO Network, or the NNN, is a global forum for NGOs to contribute to the global control, elimination, and management of consequences of entities, outlined within the internationally agreed World Health Organization Entity Roadmap. We work on the shared vision of having a world free of entities, and our objectives are as outlined here. Since its inception in 2014 and today, the NNN has evolved from a disease-centered organization to one that also addresses entities via cross-cutting groups. The NNN now is a network of over 100 members spread across various regions in the globe. The NNN has been uniquely positioned to identify common themes and develop cross-cutting approaches, and as such has strong cross-cutting groups in many key areas, including WASH, disease management, disability management and inclusion, sustainable systems, One Health, communications, skin-related entities, and conflict and humanitarian settings. The cross-cutting groups work together on shared themes and issues. Through this webinar and through the 2024 annual conference, we hope to encourage collaboration and coordination, as well as encourage the formation of regional networks across the world in an attempt to facilitate the collaboration among various stakeholders working in entities. As some of you or most of you may have come across the recent announcement of the NNN 2024 annual conference in Kuala Lumpur, this webinar is key as it lends to the theme of the conference, collaboration for change, fostering global equity and strengthening community engagement in entities. Through the conference, we are also looking to encourage and facilitate collaboration between member organizations, key stakeholders, with a special focus on civil society organizations and community engagement. To end, I'd like to also offer various ways of partnering with the NNN, either as an organization or as an entity professional. Do find details here and on our website, and if there is any information you'd want from us, if you'd like to join any of the cross-cutting groups, any engagement opportunities you want to facilitate, or if you and your organization would like to partner with the NNN, please reach out to us through the provided contacts. We now also have an in-house network coordinator who will support you with any queries, facilitate memberships, and link you with the NNN steering committee and cross-cutting groups as requested. Welcome once again, and on behalf of the steering committee, I hope you enjoy the webinar. Thank you very much.
So thank you so much to Jemish for that nice introduction. And Kat, can I invite you just to, hopefully you can come on camera if we've given you the right permission. And yeah, at least we can hear you. So yeah, we just want to have a quick introduction with you, Kat, just to introduce your new role. So do you want to tell us a bit about the new role?
Of course. So hello, everyone. My name is Kat Guyash. I am the newly appointed NNN Network Coordinator. The new role will be working in support of the steering committee and the wider NNN working group chairs, the executive committee, to make sure that the conference can be delivered as well as in previous years with reassigned resources, and we can make it as collaborative and cross-cutting as possible, as well as my role would be to support the network itself and build on previous years of experience to extend the network and grow it as much as we can, and involve all sorts of organizations and individuals, researchers in the network.
Great, and we know that we're taking a lot of your previous experience, because you've been involved in the NNN for quite a number of years now, haven't you, Kat?
Yes, indeed. For 3 years, I was the NNN Communications Working Group Chair, which is now taken over by Subina Adhikari. And it's great to be here. In my previous roles, I also worked in global health communications. My background is communications and marketing for the international development and health sectors.
Yeah, so perfect. So welcome and congratulations on the role. And yeah, we're so excited to be working with you in this new role. I think that's a great step forward. So thank you so much for speaking today. And then we're moving on now. So we'll invite Pamela Mbabazi onto the screen. So if you can, yeah, we can get your camera on, that'd be lovely. And Pamela is the medical epidemiologist. She has a long job title, so we summarised it into working at the WHO with NTDs for my E. So thanks for abbreviating that for me, Pamela. And Pamela's going to really open this session where we're thinking about the multi-sectoral coordination, and we'd love to get your insights. Thank you, Pamela.
Thank you very much. Good morning, good afternoon, good evening, some of you. It's been mentioned, my name is Pamela Mbabazi. I am with the Department of Control of Neglected Tropical Diseases based in Geneva headquarters. And in that role, one of the main things I work on is monitoring and evaluation. So my comments and inputs will be trying to frame multi-sectoral coordination, which is the subject of today in that context. Because when we talk about coordination, sometimes it can tend to be quite amorphous or quite vague. Because people do ask, what does coordination look like? How can we measure and know that we are doing coordination well? So as all of you are already familiar with the NTD roadmap, which was put together through a very broad consultation, it has two main things I will highlight among several other things, but two main ones I'll point out is the goals, and the way the goals were set. We have overarching, cross-cutting, and disease-specific goals. So most of us in the NTD space work on disease-specific issues, but we realize that to achieve the cross-cutting and overarching goals will require coordination and collaboration beyond our usual niches of the diseases that we deal with. So this is something that comes out quite strongly in the NTD roadmap. The other aspect of the roadmap, it highlights the three pillars. And in the three pillars, the first one being about accelerating disease-specific progress, which most of us are very comfortable doing. The second pillar calls for the way of working and implementing programs to move away from a siloed approach to an integrated and mainstreamed approach into national systems, regardless of how strong or how weak those systems are. And to be able to do that, it really requires coordination and working beyond our usual groups and entities as we've tended to work. So Pillar 2 is really one essential pillar that this group and what you discuss today, I hope will help us reflect and think through how we can really support this effort and call to move away from working in silos towards mainstreaming and integrating into national systems. The third pillar, which is interesting and quite important, calls for country ownership, community and beneficiary engagement. But more importantly, it specifically states about changing the culture of work. Yes, most of the programs we have, we know, are funded by donors, and we are grateful for all the support we've had for more than 2 decades to implement several of the NTD programs. But we also realize that there are a number of what we call new diseases in the NTD portfolio. The diseases themselves are not new, they are quite ancient, but they've just been brought into this fold. And they don't have as much support as some of the old programs. So the question is, how are actually countries going to be able to own these programs? How can we ensure that communities that are the recipients of all these interventions actually engage more effectively? To do this requires us to change our culture of work and requires us to measure how that is actually happening. So we have complementary documents, and I saw one of them run through as the video was being shown at the beginning of today's meeting. We put together a sustainability framework as a companion document to the NTD roadmap. And in there are 10 indicators that speak to issues related to integration. To be able to achieve good measurement on these, we need to actually coordinate across several sectors, across several disciplines, and across several programs. And this is what I really want to highlight and share with the audience today, that we have these resources, the sustainability framework with these 10 indicators, and I hope to hear from the country presentations how they've made an attempt to actually report on these indicators. And where there are difficulties, please do not shy away from reaching out to WHO to support you and see how you're actually moving in this direction. The other resource I want to share is the fact that these companion documents for sustainability and monitoring and evaluation, which have the same 10 indicators, have been put together in a training course, which is accessible from the WHO Open WHO platform through the NTD channel. So after the meeting today, I hope we'll be able to see more traffic going there so that you can orientate yourself on these resources. As WHO, we are very intentional in collaborating across the 3 levels of the organization: headquarters, regional office, and country level. We are also working to strengthen country level coordination platforms as best as possible. And we are happy to see that with the support of several partners, some countries have actually put in place their own sustainability frameworks, and want to hear their benchmarks and learn and see countries themselves, how they are moving in implementing this sustainability framework and how they are moving up against these 10 indicators that have been put together. So I'll try to keep my remarks quite short because I want really keen to hear what countries have to share. And I'll highlight just 2 more points. One is the fact that everyone is working in a post-pandemic recovery period. It's a very resource-constrained environment, so we are having to be much more synergistic in how we work and harness any opportunities that exist to sustain and maintain the public health goal gains we are making. We need sectors to come together: One Health, WASH, education, and several others, including our colleagues who work in financing, because financing is a big aspect of all this. The second is, we tend to argue that we are a very poorly resourced program in most cases, which is largely true. But also it is recognized that the global health initiatives, like really working towards universal health coverage, primary health care, will not be achieved without really making important gains and impacts on neglected tropical diseases. Additionally, the threat of neglected tropical diseases is increasing in some places with climate change. So these changes are inevitably highlight the need for us to work differently, to work with different agencies, to work with different sectors, to work with different disciplines. So again, talking to Pillar 3, changing the culture of work and bringing more players into this space will be really, really critical for us to maintain the gains. I'll conclude by saying that I'm very pleased to see that you have this working group in place that talks to multi-sectoral coordination. It emphasizes the need for us to not only work through a biomedical approach to implementing our programs, but also the need to work differently as Pillar 3 calls for. And for me, on another level, is I'm so pleased to see so many different people in the meeting, that some of them are, many of you are new. Of course, I don't know you, and I hope I have the chance to know you. It represents a new generation of health practitioners, public health practitioners, who we are urgently and critically needed in the NTD space. Most of the NTD workforce is aging out. We need a new generation of health workers who will be both actors and custodians in implementing the NTD roadmap goals in a different way, with a different culture of work that supports multi-sectoral coordination and collaboration in order to preserve the public health gains we are making as we move towards the 2030 goals. So thank you very much for this opportunity, and I hand you back over to you, Doreen. Thank you.
Thank you very, very much, Pamela, for these important messages and bringing WHO perspective into this. Now I would like to invite Professor Abdinasir Yusuf Osman to present the interactive and participatory approach to operationalizing the One Health Roadmap in Somalia, as it was reflected in the One Health National Bridging Workshop.
Okay. Thank you so much. My name is Abdinasir Yusuf Osman. At the moment, I'm serving as the chair of One Health National Level Technical Working Group in Somalia, and also Health Security Advisor at the Ministry of Health. The subject that I would like to share with you today is the experience of Somalia in relation to the implementation of international health regulation and performance of veterinary service national bridging workshop, which was indeed an interactive and participatory approach in relation to the operationalization and institutionalization of One Health roadmap. Next slide, please. So Next slide, please. Hello. Yeah. Okay. So I would like to share with you, to give you a background. As you can see from the map, Somalia is located in a tip of region, which is very challenging for epidemic and pandemic control, partly due to high reliance on animal husbandry, and also fragile health system, and also weak state capacity. The country also is a hub for live animal trading. And in 2015, for example, we have exported more than 5 million live animals to the Middle East. Therefore, the risk of introduction of the zoonotic disease to the Middle East is highly likely. Next slide, please. So the country also has a humanitarian situation, and also there is also a conflict that is going on. There is a climate change. There is also extreme weather events, and to address all of these, the country has formed a One Health structure, and where the Minister of Health is leading the One Health initiatives. We have also the Minister of Livestock, Forestry and Range, the Minister of Environment and Climate Change, and the Minister of Agriculture and Irrigation in the One Health Technical Working Group. Next slide, please. So over the last year, we have been doing a lot of activities, including the One Health simulation exercise in collaboration with UK Health Security Index, the National Bridging Workshop, and also the pandemic financing, the One Health approach in emergency preparedness and response, the transboundary zoonotic disease workshop, as well as also the capacity building in terms of biosafety and biosecurity in collaboration with US State Department. Next slide, please. So Somalia has the lowest health indicators in the world, and the government health spending per person is only $1. Therefore, it has also the lowest, what you call it, international health regulation core capacity, 33 out of 100. The Global Health Security Index in Somalia also is very low, 16 out of 100. Somalia has signed both the Biological Weapon Convention and the United Nations Security Council resolution. However, it is not ratified the implementation of United Nations Security Council resolution, and also despite being a signatory. Next slide. So internationally, a variety of tools are used to assess the health capacity. For example, the health sector uses the international health regulation developed by WHO, along with the what we call it, monitoring evaluation framework, including the JEE as well as the SBAR. And in 2016, the joint external evaluation in Somalia, 54 of the indicators were scored at no capacity, 38% were scored at limited capacity. In comparison, the animal health sector uses also the performance of veterinary services to assess their healthy capacity. Therefore, for us to bridge these frameworks, we have conducted a national bridge workshop, review the current collaboration gaps between the different line ministries that involve in One Health domain. Next slide, please. So next slide, please. These are the sub-objectives, but I will not go through in detail, but we will share with you the slides. Next slide, please. So for us to do the workshop and to plan the workshop, we have engaged higher level, whether it is a government, the Minister of Health, the Minister of Livestock, the Minister of Agriculture and Environment and Climate Change, as well as also the international organization, including WHO and FAO. This picture is that I am meeting the, what you call it, the WHO country representative to request to convene the National Bridge Workshop, and then WHO contacts FAO and also UNEP, as well as also World Organization for Animal Health to facilitate the workshop. There was also internal meeting between the national level technical working group, and also we have reached to what you call it, to use 4 case scenarios for the National Bridge Workshop, including Rift Valley fever, anthracnose, rabies, and antimicrobial resistance. The reason that we have included a Rift Valley fever and anthracnose because they were ranked among the top zoonotic disease in the recent multi-sectoral collaboration. We have also included rabies, even though it's not, it was not ranked, but we have included because it is still remains under the surveillance, and also there was also outbreak associated with rabies in the past. We have also included the antimicrobial resistance because it is a good case scenario for collaboration, and it is control that definitely requires multi-sectoral collaboration. So this is like shows there's higher level and commitment and also engagement from the government level. There's also government ownership, but also it shows you that we still depend on donor funding, where we are requesting what we call the international organization to convene this workshop. So as you can see, the National Bridge Workshop brought together international and stakeholders from human health, animal health, environment, law enforcement, emergency management, and range of other organizations. Next slide, please. So the process also normally takes 7 sessions from the opening and also the closing session. Next slide. So if you can see the result, we have also what you call it, national level representation, subnational level representation, and also the international organization, local NGOs, and also community engagement. There was also a stakeholder representation from human health, from animal health. It was balanced representation. And also we have assessed the what you call it, 15 key technical areas across the 4 what you call it, cases or scenarios that we have used. And as you can see from the figure 3, the collaboration level between the different sectors was very low across the 15 key technical areas, except the 3 3 technical area, and which is human resource and education, and those were included because they are cross-cutting issues. Next slide, please. And also, we have come almost 33 activities. 31 of them were identified as though they have a potential cost difficulty in implementation, and 33 were identified as though they have high, what you call a potential impact in implementation. Next slide, please. So overall, then the participants prioritized almost 3 objectives: surveillance and laboratory coordination at all levels, finance and emergency funding. So the development of national surveillance systems of One Health selected threat was the most prioritized objectives, along with the what you call to enhance the ability of the country to identify and also diagnose and respond to One Health selected threats. Next slide, please. So our evaluation result is what you call it, the repeated, that most of the most of the participants reported that 99% of them it improved the understanding of the frameworks of the One Health approach. Also, the framework included the international health regulation, as well as also the performance of veterinary services. 98% expected it will have a very high impact, and also 96% reported being satisfied and fully satisfied. 95% and also integration of other health sectors and also other ministries, including the Ministry of Internal Security, because there's a cross-border issue. There's also high mobility in Somalia and Ethiopia and Kenya. And there is also what you call it, security issues in where non-state actors also is operating, including Al-Shabaab. So we have also to include that one. So with that, I would like to conclude my slides. Thank you so much.
Thank you very, very much, Professor Osman. This is extremely interesting, and I'm sure that there's a lot more to learn on this. I would like to remind all participants at this point that might have questions for Professor Osman or our other speakers to pop them in the Q&A box. And if you have issues accessing the Q&A box, you can put them on the chat and we'll address all of them during the Q&A session. I would now like to invite Otene Ogbuche to present on the multi-sectoral collaboration for WASH and NTD data merge in Nigeria and the work that was done on developing the WASH NTD combined indicator dashboard. You're on mute, Otene.
Oh yeah, I just realized that. Hi everyone. So I'll just be taking us through the experience from Nigeria in terms of WASH and NTD WASH collaboration. Now, since most of the efforts towards improving cross-sectoral collaboration has been ongoing since 2018 or thereabouts for between WASH and NTD in Nigeria. Now, site savers facilitated most of these actions, working with the Federal Ministry of Health, the Federal Ministry of Water Resources and Sanitation to come up with a dashboard for NTD and WASH. This led to the development of a combined indicator dashboard which has been hosted for Nigeria. Next slide, please. Now, the process of developing the NTD WASH combined indicator dashboard went through certain stages. There was a landscape analysis that was conducted, and following the landscape analysis, some findings from this led to the formation of an interministerial group made up of the FMOH, as the Federal Ministry of Health, the Federal Ministry of Water Resources and Sanitation, as well as other groups such as the National Bureau of Statistics, UNICEF, and others, to come up with indicators for especially 4 PC NTDs like trachoma, schisto, STH, LF, and of course for the WASH data. Now, WASH data was pulled off from the WASH norm reports. The WASH norm reports is a reporting of the WASH status for the country, which is a compendium of reports that has been collected from the subnational levels and is domiciled with the Federal Ministry of Water Resources and Sanitation. So we had the indicators developed and combined from NTD and for WASH. Following on to this, a national stakeholders meeting was held in June 2022, during which a data merge dashboard was introduced to key stakeholders from all the sectors represented. Staff of the Ministry of Health and the Ministry of Water Resources were also engaged and, trained and taken through the process of updating and getting the data on the dashboard. And in June 2023, the NTD WASH dashboard was launched on the Water, Sanitation and Hygiene Information Management, which is WASHIM's dashboard. That is live now. Next slide, please. Of course, as with every such activity, it was not without some challenges. In the process leading up to this, lack of an NTD platform to host the NTD WASH data merge dashboard was one of the challenges that was experienced, and differences in indicators and data capture levels for NTD and for WASH data was also one of the challenges. And of course, bureaucratic bottlenecks at interministerial levels, that's between ministries and other agencies, was also experienced. Now, to overcome these challenges and how they were resolved, the WASHIMS platform was identified as a suitable platform for hosting the NTD WASH data dashboard. And then, of course, the development of combined indicators to capture the NTD and the WASH data and present it at appropriate levels also, helped to close the gaps in terms of data level captures. And then sustained coordination meetings and advocacy to relevant ministries. There was continuous engagement with all the identified stakeholders involved, to bridge communication gaps and close whatever bottlenecks had been experienced. Furthermore, to strengthen the collaboration, national and subnational level engagements were held. The national level stakeholders meeting was held to introduce the data merge efforts, and decision makers, key policy persons, and from government, from the private sector, and other development partners, especially in the NTD and the WASH space, came together, to look at this, to ensure the buy-in and, endorsement, or so to speak, of these groups. Especially at the subnational levels, joint planning and coordination meetings have been held to continue and sustain the cross-sectoral collaboration. So you have situations where you have joint planning meetings with the NTD and the WASH space, to encourage, continuous collaboration, so that you have a situation where the different sectors are not working in silos. Next slide, please. Now, some of the key learnings and recommendations from the data merge efforts. It's important to note that interministerial engagements were some of the very important learnings to achieve the strengthened collaboration. It's important to know that when ministries, departments, and agencies work together with development partners and others, that strengthens the collaboration efforts. And then working with the lower units, because all the data comes from the subnational levels, is also a very, very strong sustainability effort to ensure that data is collected timely and updated on the dashboard. And of course, like I mentioned before, joint program planning, and then leveraging on existing structures and platforms for both NTD and WASH in the intervention areas, like we did hosting the dashboard on the WASHIMS platform. So that's the experience from Nigeria. Thank you very much for listening.
Thank you very, very much, Atene, for sharing these meaningful learnings from Nigeria. For our last speaker, I would like to invite Dr. Jean-Jacques Tougo to share the experience of developing a multi-sectoral coordination platform and how it has supported the sustainable control and elimination of NTDs in West Africa.
Hello, everyone. I'm happy today to present on the topic how multi-sectoral collaboration supports the NTD program from our experience and partnership across the region. Next. Here is the outline of our presentation. So we will talk about the importance of collaboration, how it's operationalized, and we will talk about cross-sector approach and strategy involved. And we also discuss some country examples and share the lesson learned. Next. I would like here to give you some background information about the actual project. This is a project funded by USAID with the objective to support elimination and or control of PCNTDs. Our focus extends beyond disease control as we are committed to strengthening the country environment for the implementation and management of NTDs. So the geography scope is 11 countries, as you can see here, Cameroon, Benin, Burkina Faso, and so on. And World Vision work is to provide kind of technical assistance, to ensure long-term and sustainable delivery of NTD services. We have a consortium of partners with Prime being the FHI 316, along other organizations, Ellen Keller, Deloitte International, Health and Development International, Deloitte, American Leprosy Mission, and we leverage each other on expertise and resources to achieve our shared goal. Next, please. Before elaborating on multi-sectoral approach, it's important to understand the sustainability framework represented by this graph. This has been developed based on area carefully defined. You can see them on the top of the graph, and this frame is structured around 6 functional areas. Circle here in blue. Click, please. And not yet. I'm still on the This sustainability framework has 6 functional areas. Rather than view this area as functional area, they has separate area. They are interconnected. There are also 6 outcomes here in green. They have been proposed based on core function. The health system that accelerate the cross-cutting and disease-specific progress. You can see that the framework demonstrates the importance of working across all the system from the central level to the community. And we're going to see that the multi-sectoral collaboration click is at the cornerstone of this sustainability framework. Next, please. Here is the approach, five-phase approach. At the center of our strategy is the identification of counterpart and consensus building. So by bringing together stakeholders from diverse sectors, we create kind of foundation for sector collaboration. And you can see here from there, we can go through other phases like landscape analysis to identify gaps and key opportunities in relation to the 6 outcomes I mentioned earlier. The development of the sustainability plan is implementation, the monitoring and evaluation of progress indicator toward milestone. One important aspect of our approach is the development of the bilateral sustainability agreement, which is kind of agreement that serves as a guiding document outlining commitment and milestone. Next, please. As we review cross-sector coordination mechanisms for various countries, for this presentation, we will explore examples from two countries, Ghana and Mali. And we will focus on the mechanism put in place and their perspective, activities, or achievement. Next, please. This slide highlights the pivotal role of the intra-country coordination committee in promoting multi-sectoral collaboration for NTD in Ghana, established in 2018. The ICCC underwent a revitalization process in 2020. This committee serves as a good example of successful cross-sector collaboration. At the bottom left side of the slide, we can see the key platform involved in this collaboration. And on the right side, we can see some of the notable achievements. For example, the engagement of local decision makers through high-level meetings, the development of the NTD WASH coordination framework, also the revision of the National Health Insurance Scheme benefit package to include coverage for 12 endemic NTDs. We can also mention the support provided for mainstreaming NTD at the primary healthcare structure level. Next, please. Formally, we can talk about the establishment of the National Multi-sectoral Coordination Committee, which stands as a beacon of this effective coordination. Established in 2021, this committee brings together stakeholders from various sectors, as shown by this key platform. And talking about some of their key achievements, we can mention the technical considerations, bringing together stakeholders from both health and non-health sectors, along with key technical partners. Their support for the elaboration of the sustainability plan and their huge implication in the development of the NTD WASH module that integrate NTDs into academic curricula. On this final slide, we like to gather lessons learned from Ghana and Mali experience in terms of challenges, opportunity, and perspective. And as you can see, financing the sustainability plan emerges common challenge faced by both countries. And I believe this appears a reality across all the countries. The major opportunity in Ghana appears to be the linkage between the ICC and subnational structure, whereas in Mali, it's about strengthening inter and intra-sector collaboration and coordination. To set a few key perspectives in Ghana, I will mention the roadmap, kind of effective roadmap for the ICC, mobilize support for the ICC to system enhance the capacity of this committee. For Mali, it's about training teachers for the implementation of module, to organize internal resources mobilization workshops to support a sustainable effort for NTD intervention. I think that's it for my presentation. Thank you very much.
Thank you all to everybody that's presented today. And I'm sorry it's been a bit of a whistle-stop tour, but we obviously had a lot to get in a short space of time. And I think you all did a great job of giving us a taster there from various different sectors. Now, I'm afraid the Q&A function doesn't seem to be working, so we are just using the chat, which I have been trying to monitor. We are just going to have a couple of minutes for questions now. So firstly, I should introduce myself. Sorry, I'm Gabby Lang. I am the chair of the One Health Cross Cutting Group today. So that's the group looking at how we bring together human, animal and environment health and take a kind of systems-based whole system approach to NTDs. And I suppose I'll just take a couple of questions here. I think we had some questions in from the audience to Otene first, around the how the data will be updated on a regular basis. And I think this is probably something which will be relevant to people generating more integrated databases across different areas. Certainly, if we're looking at surveillance, for example, if we're doing surveillance across species, you know, how do we integrate that data? So Otene, if you want to give us a brief answer, that would be great.
Okay, thank you. Now, for the updates of the data, the NTD data, of course, is housed at the Federal Ministry of Health, while the WASH data is pulled from the Federal Ministry of Water Resources. And during the engagements leading up to the development of the dashboard, both ministries have agreed to update this data regularly, which means every year, because every year they have they put the data together, and they will be able to update that once they have their data for the year ready. For example, for the NTDs, the Federal Ministry of Health have people who have been dedicated and trained on updating the data. They have access to the dashboard and can update data when there's new data to update. So the responsibility for that lies with both ministries, since they are the owners of the data. For us at Sightsavers, it's just to facilitate to know, okay, what is happening, and if that data has been updated. So they have an agreement on how to do that, and they have access to do that.
Yeah, I think you've touched on a really important point there in terms of country ownership and what difference that can make to the sustainability of intervention. So thanks for that, Attorney. And Jean-Jacques, I was just listening and with interest on the Inter-Country Coordination Committee that you said that was set up in Ghana, and the types of ministries that you managed to bring on board. I wondered how you engaged those ministries that perhaps weren't part of that NTD conversation usually. Was that a difficult thing to do, or did you find that they were quite willing to join in? That was to Jean-Jacques.
I'm here.
Great.
Yeah, sorry. And no, not an easy task. This is a long process. And as I mentioned earlier, and going through this, we have worked basically in Ghana or like in other country to go through different steps. And what we did basically was to make sure that we have collaboration in country in terms of partner, in country partner, and to make sure that we go through a kind of landscape analysis to understand the gap and key opportunity, and to make sure that we develop the work plan and make sure that the ownership, the NTD program is leading the development of the sustainability plan. Through their engagement, this ensures that the plan is tailored to the specific need and priority to each country. And this is how we were able to bring them on board and work in a collaborative way to develop the sustainability plan, and then to have kind of multi-sectoral collaboration with the ministry and so on, including health and health sectors.
Great, thank you for that very brief answer to a very complicated question. I'm sure it'll be something that we can revisit as well at the conference later in the year. And a final question on One Health to Dr. Abinasir. Obviously, I got to come to the National Bridging Workshop, and I found it incredibly interesting to see how the models, the disease models that you were using, were a kind of tool, a scenario tool to help people plan through. So I wonder if you think it would be a good model to maybe adapt for NTDs, and whether there be opportunities to do more small scale planning, maybe around how best to coordinate between public health, veterinary public health, and environment public health.
Okay, thank you so much. Yeah, thank you so much. Yeah, we have used those case scenarios, and they were quite perfect in terms of the testing the collaboration gaps between the key line ministries that involved in One Health domain. And the most important thing is the rationalization of it is that those case studies, because of we have used it because Rift Valley fever, for example, is prioritized. And as you might aware of, we have recently prioritized zoonotic disease. And among those 7 top diseases was Rift Valley fever and anthracnose, where we now included as a case study. Along with that, also there was trypanosomiasis and also bovine tuberculosis, and also tuberculosis, along with Middle East respiratory syndrome, which is quite very important because Somalia is a hub for live animal trading. So even in the One Health, also we have also neglected tropical diseases. It's also part of the program, but in most cases, is those zoonotic disease of pandemic potential we are interested because in Somalia. So and hopefully at the moment, because everything is at initial stage in Somalia, we have recently formed the One Health Zoonotic One Health Technical Working Group, and we have almost done 8 workshops in terms of capacity building. But what it shows you that there is a political commitment from the higher level, and also there is also national ownership of the program. But still, we are depending on the what you call it, the donor funding. Therefore, it might affect the long what you call it, the sustainability of the program. So therefore, hopefully in collaboration with the NNN along with other networks, we will also focus in the recent future at the neglected tropical diseases, and hopefully we will have a productive collaboration. Yeah, and thank you so much. Yeah.
Thank you very much to all our speakers. I shall pass back to our hosts for the closing comments and a final poll, I think.
Great, thanks so much, and that was absolutely amazing to hear so much. I feel we crammed a lot into that short space of time, and we'll be sending the recording out so you can look again, because I know some points went quite quickly, and also it'd be really interesting to hear back from you guys, you know, what would be interesting to hear more of, and part of this is like, would more webinars be useful going forward? So it'd be great to get your feedback on the poll shared on the screen, and yeah, connecting with the groups. We have a very short amount of time left, but Jemish, our chair of the NNN, has hopefully managed to join the call. We had a few technical difficulties. If Jemish is here, please come on camera. We might not have her. No, I think she's near. She just had sent a few closing remarks just to remind everyone. I'm just bringing it up on screen here. Just to remind everyone that the NNN 2024 conference is in Kuala Lumpur, and a new announcement is that a lot of people were wanting to submit workshops, posters, etc., and the rapid fire, and the deadline has extended to the 28th of April now. So that is good news for those of us thinking about preparing a submission for that. So she just wanted to say thank you on behalf of the NNN, and yeah, for sharing all these comments. So I guess from our point of view as the cross-cutting groups, we are really enjoying this collaboration here today, and we hope that you'll engage more in the NNN cross-cutting groups. And so please use the QR codes and the links that have been put in the chat to engage more and yeah, make the network even more powerful. Doreen, I'll go to you for any last comments.
Thanks, Carolyn, and thank you everyone for joining us today. As mentioned in the beginning, if anyone is interested in joining one of the cross-cutting groups, please go into the chat where Anna popped in the link, and you can get all the information on all of the cross-cutting groups, and also feel free to approach any of the chairs directly to get more information. It was lovely having you all here, and thank you. I will add to the chat the closing remarks sent by Dr. Jemish, so just so you all see her inspirational words. And yeah, thank you, Carolyn, for heading all of this on behalf of all the cross-cutting groups.
And yeah, round of applause for our, even though we can't hear anyone else, round of applause for our great speakers. We can do a little a reaction, and yeah, we'll close the webinar there. Thank you so much, everyone, for joining. Have a great rest of the day wherever you are in the world. Thank you so much. Take care.
Thank you.